I'm Todd Neal with MedPage Today. The number of obese children continues to grow, and with it, the rates of various cardiovascular risk factors. A study at the American Society of Echocardiography meeting decided to look at whether early cardiac changes could be detected in an obese pediatric population and whether insulin resistance played a role. I spoke with Dr. Gautam Singh of Washington University in St. Louis about the results.
So question is whether obesity, which tracks from childhood to adulthood, and in adulthood there are evidence that heart function starts deteriorating even in absence of symptoms. So question was whether the heart function is also abnormal in this patient's population, in pediatric patient population, and if they are, why it is. So one of the way to find out at least is based on the animal studies that insulin resistance, which is resistance to the action of insulin to the different biochemical and other functional parameters in the body, is it resistant to the insulin action or not? And so we try to investigate that, and we trying to find out what's the mechanistic way of cardiac dysfunction or abnormal cardiac function in children if it is there.
To explore the issue, Singh and his colleagues recruited adolescents who were obese or had other cardiometabolic disorders from a preventive cardiology clinic. All had comprehensive evaluations, which included speckle track and echocardiograms.
We had about 90 patients in this study. Final patient population was about 77, 78. And then we, depending on their level of insulin and insulin resistance, we divided in two groups and wanted to study what's the difference in cardiac function between the two groups, one with insulin resistance, one without insulin resistance. And we found that those who have insulin resistance cardiac function by more newer modality, more novel method of examining the heart function, they were abnormal. We found that insulin resistance along with increased body weight, means body mass index, were the most two important factors which predicts abnormal cardiac function in children with obesity.
Singh discussed the clinical implications of the findings.
And the message would be, in a sense, that cardiac problem or cardiac dysfunction, hardening, whether it's as well as the hardening of the arteries or coronary arteries or blood vessels of the body, they all do start during childhood, and therefore intervention should also start during childhood. So it will be like a primary prevention, so that we don't have all the inherent complications and problem having a delayed diagnosis and delayed management.
Singh said the next step would be to determine whether these early cardiac changes can be reversed through lifestyle changes and other interventions. For MedPage Today, I'm Todd Neal.